See, if the question comes to demography and its health impacts, you see the slides. Everything is extracted from your K-Park book. The book I have told you to read and refer, because everything is explained in simple English and with some medical term. There is no fancy thing. See, this is the book. See, if the question came at demography and explain demographic profile of India and its impacts on health. See, this is the slide you need. You may take pictures also, or you may write also, but everything is in your book. You have to write the definition in this way. Okay? Then you have to explain that demographic cycle and how it focuses and the topics or the factors on which the demographic cycle is dependent on it. See, I've told you in the last class also, these are the three phenomena: changes in population size, composition, population distribution, and population space. You may not have to explain everything, but you have to write these major lines at least. See, okay? Then the factors that affect the demographics, as I have told you, see, these are the factors. And in the lower part, I have had some information, but you don't have to write these things. You have to refer to the part book, and you will see these things are written there. The latest growth rate of India is 1.2%. Okay, estimated in 2020. Okay. See, these things are there: socio-economic, history, urbanization, industrialization, birth and death rate, contraceptives, and values. Transition of values. See, transition of values is also a short note. See, transition of values. Okay, guys, you have to face exam in your third semester, so you have to make a note of these things and show it to us. Proper notes of 10 marks. Okay. See, this is the transition in demography. You don't have to explain everything. You just see if the short note came, and everything is in your book. Okay. This is the demographic transition. See, demographic stats sources you have to write in the after definition. You have to write the sources from which you will explain the impacts and the trends of demography. See, national survey, registration of vital events, ad hoc demographic studies. You don't have to explain everything. You can in bracket you write the gist of everything. It is written in your book. Everything. Okay. I have taken the whatever is necessary. I have taken this information. See, I have shown this in your last class also. Okay. Registration of ad hoc survey, ad hoc demographic studies. Okay. Next, demographic cycle is very important question. If demographic cycle question came, you have to write. You have to write these 5 stages of demographic cycle. I have told you: high stationary in pre-industrial arena, in pre-industrial area before 1900. See, early expanding. See, I have told you in developing countries you can see late expanding. You see in India, China and Singapore, countries like this, in industrial area, in low stationary, low birth rate and death rate, resulting in stationary population. Okay, declining rates is theoretical, but see, next slide. This is the graph you have to make in exam. This at least the upper part of graph you have to tell which part is high stationary, early expanding, less, because if you don't make the graph in your exam, then examiner will not be convinced whether you genuinely knew the topic. If you made the graph, you write something also along with it, you will get a good marks. See, you have to write it in this way. At least you will give an example of each types. I have shown you in your last class. This is the explanation for if only the graph or if only question came only write the graph pattern of demographic cycle and explain, then this slide is enough. And you have to previous slides you have to explain that after making the graph you have to explain writing these points. Okay. See, there is a question for you: how to calculate growth rate. You can write in your copy. You can show me later the result. See, the formula for growth rate is new population minus initial population divided by initial population into 100, and the whole factor will be divided by 10. And another easier formula is you just minus crude birth rate and crude death rate divided by 10. So I give you example. You can write it and show me the result. Show me the result in later class. Okay? There is a problem for this question may come, may not come. See, usually mathematics or statistics this question doesn't come in MBBS, but they in term paper they may ask, or in vivas they may in or in practical. Okay? See, don't do contraceptive, don't do mention. Okay? These are the method. You can write it in contraceptive if you mention in contraceptive parts. See, contraceptive your factors in that part you can just put the names of the contraceptive methods, only the names, you don't have to explain everything. Okay, see, these are the contraceptive methods, just write the name, temporary methods, OCP, condom, injectable, intermittent devices. Okay, this thing will be more focused in your option guiding only. Okay, these are the topics. The permanent methods, female stimulation, menstruation only, just name only, nothing else. Okay. These are the contraceptive, and this given the contraceptives only. Doorstep delivery system, these things. Okay. Spacing methods also in contraceptive method, natural method, barrier methods. Just write the names. If you written a point in your question answer about contraceptive, just mention these things. At least examiner should know that you know these topics. Don't have to see the mechanism. See, this is then the main question, the 4 marks question or the 5 marks question. This is the slide you should start. If the question came from asks you about the impacts on health of the demographic cycle of India. See, you have to write these things. These things are written in your book, but I have listed out whatever is necessary. See, demographic monas is a short note. Demographic monas is a short note. I will explain the short note in later slides. The key demographic trends: young population, age, sex, population, pyramid of population. If you write pyramid of population, you have to make 2 small slides of pyramids. Compare India with another country, and you have to explain the pyramid of population. I will show you in trends. You have to take reference from the trends to this question. If only trends question came, you will write the trends. And the impacts on health on came, you have to take references from the trends, which the trends are given in your book. These things are not. I have taken references from the trends and made the slides or to fill it properly over the impacts on health. Okay. See, this is the way you should write. Okay. Next, rapid reparation is there. These things all are impacts on health. See, I've shown you in lifestyle also. Literacy in education, migration, these things, life expectancy, mortality and fertility. Okay. Continue the health challenges. Health challenges of the impacts. Health challenges I've shown you. NCD means non-communicable diseases like heart disease. Access to healthcare. See, rural areas have less access to healthcare than urban areas. Socio-economic factors, malnutrition, infectious diseases. So I have shown you the questions. The question may be broken up in 2 to 4 marks, 10 marks question come na. So here every slide is a 2 marks or 4 marks question. The impacts on health usually come in 4 marks question, and demographic cycle, demographic bonus, these things come at 2 marks question. Another thing they will ask you about the trends. See, you have to explain accordingly the big mark question. If the question is 4 mark, then you have to write everything. If it is 2 mark, you have to just write the points. See, impacts on health continue here also. See, the 3 or 4 slides are there of impacts on health. Non-communicable disease, you have to explain. Everything you write, you have to explain. At least examiner should know that you know the topic. You have to explain these things, at least 1 or 2 lines about the diabetes, coronary vascular disease, hypertension. See, rule of halves is a short note. They may ask also rule of halves. They may ask you which disease show the rule of halves phenomenon, which disease will show the iceberg phenomenon. These things I have explained the lifestyle. See, I will show you. This is the way you should write. Then investing in healthcare infrastructure, you have to explain it. Even I have explained it there. They are promoting health style, addressing socio-economic inequalities, strengthening of health workforce, data collection and monitoring. Okay? See, this is the iceberg phenomenon. This is a short note, 3 marks or 2 marks question. Yes, since you have wrote in your, you write in your previous slides, you write in your exam paper, iceberg phenomenon, you have to explain 3 or 4 lines to get the good marks at least, full marks. Otherwise, the examiner you don't know anything. See, you have to explain the iceberg phenomenon. There was only the small portion. See, iceberg phenomenon. You look at this. You see iceberg in ocean. Na? Only tip is visible. The tip indicates the visible cases. See, there are 10 people. Out of 10 people, 1 people will tell you, see, I have clinical illness, and rest of the 9 people have their own diseases, but you cannot detect. This is the iceberg phenomenon. Death. The tip of the iceberg show you the visible cases, death and clinical illnesses. And the submerged part will show the asymptomatic, will not be seen to you. These are asymptomatic infection, invisible cases, carriers. In TB, see, I have explained these are the cases, non-communicable diseases like diabetes, hypertension, cancer may often get undiagnosed. So these are all asymptomatic. HIV, reported cases, HIV is the tip of the iceberg. HIV cases are very less diagnosed, but there are lots of HIV positive cases in the community. The mental health disease is a burning topic. Mental health disease and iceberg phenomena, they will ask you. Please explain mental health disorders. You have to explain it from your book. Some 3 or 4 lines you just write. You at least the examiner should know that you know the mental health disorders. These are I have not explained, but I have written the whatever relevant points according to iceberg phenomena. The tuberculosis, potent energy malnutrition. You will explain. You will learn it in pediatrics, and substance abuse also. Substance is a very important topic. See, this is the iceberg phenomenon. And see, if rule of halves came in your exam, then you have to make this slide. You have to make this graph. See, the whole, look at this, the whole red circle is the whole community, supposedly 400 people. Rule of halves is half of the people, how they were. Out of the whole population, half of the people will show the disease. And out of the diseased population, see 400, then 200. Don't see these numbers there. These are not correct. I will just focus here. See, this is the full community, and out of this half community will be diagnosed as either hypertensive or diabetes or some other disease. Usually diabetes and hypertensive patients show rule of halves phenomenon. 50% of the population will show the disease, and out of this 50%, see, this is the hypertensive, the white undiagnosed hypertension cases. Okay? White part is the undiagnosed case. Out of this, 50% will become diagnosed, and 50% of the diagnosed hypertensive patients. See, 50% of the diagnosed hypertensive patient will get adequately treated, and rest of the diagnosed cases, they will be inadequately treated. This is very simple. Whole community. Out of the whole community, the red part is normotensive, normal subject, but the 50% patient cases are diseased, either hypertensive or diabetic, and out of this 50% will get diagnosed, and rest of the 50% white part, they will not get diagnosed. And out of the diagnosed cases, this blue area, 50% cases will be diagnosed and treated. See, white part. And 50% of the diagnosed and treated cases, they will be adequately treated, and the rest 50% will be inadequately treated. This is how you should make. It's very easy slide. Just remember and point out the things. 50. Total population, 50% of the total population will get hypertension, and out of that 50%, half of the population will get diagnosed. Okay? And that diagnosed population, half of the cases will be diagnosed and treated. Okay? And out of the diagnosed and treated cases, only 50% will get adequately treated, and rest of the person will be inadequately treated. This is very easy. Okay? This is a short note. Okay? This is I have explained it. Rural houses describe prevalence of disease, particularly hypertension, diabetes. Where significant of population individuals remain unaware of their condition and or are diagnosed but not adequately treated. See, I tell you, this essentially outlines a cascade of unmet healthcare needs. How of the people with the disease are unaware? See, most of the people may get unaware. You know this. You see, the predisposing factor is that your family member, your mother may get diabetes, may be diabetic or hypertensive. So it is better you should also check your BP and blood sugar regularly to prevent to get diagnosed early. See, 50, how of those are aware and untreated, and how of those treated are not adequately controlled is very important thing. See, unawareness, untreatedness, inadequate control. These things are relevant to this rule of halves, and they are seen in hypertension and diabetes. Diagnosis and treatment gaps. This is the many cause of this phenomenon. Many individuals with diabetes remain undiagnosed. See, their blood sugar levels remain normal after repeated examination also, repeated test. But in generally, if you check his HbA1c, then you will may see the trend of the disease. It is rising trend of HbA1c will confirm your diabetes. See, everything is a health system weakness. Health system is also weak. We may not get the good history or family history of the patient, and that lead to undiagnosed cases. Unawareness. See, follow up of family history of diabetes, hypertension, as if parents got such that children may also suffer. Global public health poses. See, diabetes. India is epidemic of. India is the capital of diabetes. Okay? And it is getting also a top position in hypertension also. See, need for improved care. Rule of halves require effort to improve. Early detection is very important. Access to treatment and adherence to care test. Okay? See, these things are not that important. So I told you the pyramid. If you tell the pyramid, just make this type of slides, this type of graph. It's very easy. Just write, this is the pyramid of this country, Switzerland. Along with it, you compare with the Indian graph, pyramid. See, impact on health, finished. Okay. Then demographic trends. Demographic trends is the question I asked you to explain the demographic trends. You have to write these things and you have to explain. At least if you you have to remember at least what are the points. Remember, you don't have to write everything. So you have to write the gist of everything. At least the examiner should know that you know these topics. Demographic indicators, age and sex composition, pyramid population, sex issue, dependency, density of population, urbanization, family health, literacy and education, okay, life expectancy, then mortality and fertility indicators. Okay? See, I have shown you in the previous slides also, previous class also. These things you have to write. I have changed something from the previous slides. These things you should write at least. Demographic indicators you have to explain. Then two parts, population and demographic indicators divided into population and statistics, vital states into these things: birth rate, death rate, natural growth rate, life expectancy at birth, mortality, fertility rates. See, this thing, the lower part you have just, if you can mention, you can mention, but you have to mention the main important topics. See, these things are not, if you can mention the top 3 lines, not this lower part. If you can mention this thing, it's good, extra. And it is taken from your K Park book only. Okay? Then age and sex comparison is the second trend. See, I have explained 0 to 4 years, male age group, then 60 plus females, then females are more than males. I have explained in previous, you just see and repeat and revise it. Then the population pyramid. Okay? Population pyramid, the youngest are at the bottom and the oldest are at the top. It's a pyramid of population is growing. As more as babies are born, then dead, and thus forming a triangle. Okay? This can be used to compare male and female of population and also find out dependents and general structure of population at any given time. Okay? You see, I've told you the pyramid. Just you made this graph now, compare India with Switzerland, the examiner will be happy. You just mention it. The older population are more in developed countries than India. See, 10, 20 to 25 age group group is more in India, a working class, young population, which helps in which causes the demographic bonus in compared to Switzerland or developed countries. See, they are old people, 50 to 60 years, they are more in compared to younger age groups. See, sex ratio is the fourth term. It's the number of females per thousand males. You have to explain the sex composition and the factors which affect these things. See, low sex ratio means male dominance, less gender inequality, negligence of female child, female feticide, male biased society, abortion. See, IPC 312 and 318, these things are extra. These things are extra. You can, if you write, it is very good. This deal with this type of illegal abortions. IPC 312 to 318, miscarriages, injury to unborn child, abandoning of infants, concealment of birth, death of quick unborn child. Okay? And they, you have to explain the main part, and rest of the lower three of low lines you can write it for extra marks. Okay? And you have to also put it the which state have highest ratio. Next slide. MTB Act. MTB Act. Okay. If you can mention this thing is good. See, it prevents the illegal abortion in India. This act, and also it helps the woman to get a legal abortion in this type of situations. See, this type of situation like humanitarian in rape cases, eugenic fetal deformity. If the fetus is deformed, there is no point to continue the pregnancy. Contraceptive failure, medical ground, health risks of mother, and socio-economic. If the woman has 3 or 4 babies previously and she is very poor, there is no need or no reason to get pregnant year after year. Okay? MTB Amendment Act. You have to focus on the latest part. Okay? 2021. Don't need of 1971 part. The latest one RMP required till 20 weeks, 2 RMP required till 20 to 24 weeks. Okay? Medical board approval after 24 weeks. Okay? Next slide. See, dependency is the fifth trend. You know, the low dependency is 2 types: young age dependency and old age dependency. 0 to 14 years and 65 years, above 65 years. And it dependent on what? Dependent on the working class. Working class. See, middle part, 20 to 60 years age group. These are the working groups. They are dependent on this part. You have to write it. If you can put this formal also, it is good. If not, it doesn't matter. Just you have to explain this. Then at least you know. See, I am telling you demographic bonus is the short note. You have to write the short note. See, I have explained the this demographic dependency ratio determine burden on population of a country in developed countries and also in some developing countries. You have to edit. Early development phases rapid fall in fertility reduces the dependency ratio. But in later stages, old age people will be more due to longevity, which increases burden on health. As we see now, a shift from child dependent to old age dependent as life expectancy increases. Yes, more than fall in fertility, and this indicates rapid economic growth. And this period is demographic bonus. The period depends on pace of decline in fertility, and if switch to nuclear families is fast. Nuclear family is very small family, 2 or 3 in mother, father and the child. Okay? Nuclear families is fast, then this bonus will give genuine boost to develop. You have to write these things now to get the full marks. You have to write it. These things I have taken from your book only, but the way of writing the presentation should be good. See, if investment done, I'm continuing the demographic bonus. If investment done on healthcare and education for skill development during this demographic bonus, maximum advantage is taken out of this demographic transition. with higher economic growth rate. See, opposite of demographic bonus is demographic burden. It is increase in total dependency ratio during any period of time, mostly by increased old age dependency. More old age person, see, you will give the demographic bonus also. Working class will increase, but with time, old age people will become more and they will increase dependency on a country on health services. Okay? And is inevitable consequences of this demographic transition, old age dependency. See, and a country has to face it sooner or later. Every country has to face it. Every developing country, developed countries have already facing. See, you can see in Japan also, old age people more. They are promoting 3-day, 2-day work policy to increase their total birth rate, increase their population growth rate. It's opposite of demographic bonus. See, 610 is density population. Just explain the density taken from your book. Kepa, I have shown you the image. How dense population you have to explain. The urban areas, urbanization. See, urbanization is a short note. They will ask you, what is urbanization? You have to explain it. See, urbanization, people living in urban areas with population more than 1000 per square mile or 390 per square or 3 people of the male are employed other than agriculture. Agriculture, if they are employed in agriculture, they are not urbanized. India tends to predominantly rural with agri is the main occupation. See, these are population I've shown you in the last slide. See, these are the Kuala and Delhi. You can write it. Kuala Delhi come in separate part. Quality adjusted life years. Then Delhi is the measure of years in perfect health loss. Disease burden. It indicates burden of disease by summing years lost in premature deaths. Disease adjusted life years. Okay? See. Next, family size is another trend. See, I have explained it in the previous slide. Same thing. The family, usually the family size will explain how much a woman in reproductive age group can bear. How many children a woman can bear, na? See, approximately or complete family size. Okay? Family size depends on duration of marriage, education of couple. Very important thing. You have to tell the factors which affect each trend. Otherwise, the examiner will not be confused. Will not be convinced. See, in living children, prevalence of male children, desired family size, family planning based on 2-child norm in view to reach net reproductive rate of 1. Family planning, decision of regarding desired family size and effective limitation of fertility once the size is reached. Very simple English, everything is written. I have made the slides from your book only. You have to go and read and make the notes and show it to us. Okay? See, literacy and education is another trend. Higher literacy, higher education, less will inversely affect the birth rate. See, I have told you, higher levels of literacy linked to modernization, urbanization, industrialization, communication, commerce and facilities. Okay? Then higher literacy contribute to improve economic condition and better use of healthcare facilities. Okay? Literacy usually shows 7 years of age and above, and the person deemed literate if he or she can read, write with understanding any language. If only read or not write is not considered literate. Very important thing. They will ask you this thing. See, a guy can read only but cannot write. He is not literate in that language. He or she must read or write a single language to get literate. See, this thing you can write it after explaining the literacy. This thing 1 to 3 points. Kerala, which state is top, which state is less. See, these things 1 to 2 lines after explaining a trend is very good for getting full marks. This is the formula of effective literacy rate to literacy rate. These things may or may not come, but usually in practical statistics they will tell you. Okay? These things are not the life expectancy is the another trend. Average number of years which a person of that age may expect to live according to mortality pattern prevalent in that country. It is country based. Every country has different life expectancy. Developed countries are more, developing and very poor countries are very less. The best indicator of a nation level development and overall health status of its population. Globally, it has risen from average 46 years from 1950 to 60 or 70 years right now. India, you have to write this thing. India, 64 years average for male, 67 years for men. 2011 data. This data is taken from your K-Park latest edition. You don't have to confuse between different edition or other sources. So you first stick to. You can also write from if you find different sources have different, you can write this, and in bracket you can write from K Park 27 edition. That will give you 100% marks, because examiner know that you have taken reference from that book, because these data statistics they are different in different books. But if you stick to one book and you write in bracket they have taken reference from K Park, it will be more than enough. Trend in life expectancy shows that people living longer life has right to live more longer healthy lives than those with pain and disability. Yes, these things are very, this line is, this everything I have written is very important. Thus policymakers need to recognize this change of trend to control and prevent diseases associated with old age. Okay? See last of the indicators, see last of the trends is the fertility and mortality. These things are, this thing have already, I think your health indicators, you know, you have taught, you will be taught previously in health indicators. I have explained everything. Again, mortality indicators depend on cruise death rate, a specific death rate, expectancy of life. I have shown before. A specific means younger age, infant mortality. Your A specific means younger age group and old age group. Okay? Infant mortality rate, it is the ratio of the, you know, 1 year age total divided by total life births of that year. Because universally accepted as it is a sensitive indicator for availability and effectiveness of healthcare. Infant mortality, not the previous one. Infant mortality is a universally. They will ask you this thing, these small things, na. They will ask you in exam, in viva, or if you can write it, na. The more you write, the more you prepare these notes, na. You will remember what thing you can add in extra in your notes. See, adding extra in your notes is always good for health, and removing or omitting or skipping things is always not good. Examiner always seeks for more. You will see how much you gather, you gathered your knowledge, and will give marks accordingly. On an average, if everybody writes this thing, they will get 7 or 8 out of 10. There are 2 marks, they will always become biased, because examiner, he will always think the student should write more and more, but within limited time period, you have to write this thing. It is very difficult to gist out these things and write in a shorter. They have to practice, you have to write, make notes, practice. You have to, every day you have to read, you have to practice, otherwise you cannot finish in a stipulated time in exam. See, child death rate, madam also taught you, sir also taught you these things in health indicators. Under 5 proportional mortality rate, this is the under 5 rate, and under 5 more 1 to 4 years. See, this will not include the IMR. Okay? These things under 5 include 1 to 4 years of that. Okay? See, adult mortality rate 15 to 60 years of age per 1000 population. Death. Okay, maternal mortality rate, disease specific rate, death rates, communicable and non-communicable diseases, death rate, example rate of COVID, TB, cancer, diabetes, coronary disease, accidents. See, communicable diseases are, I will explain you this the way the disease may spread from one person to another. Tuberculosis, COVID, any infection, see viral infection. These are all communicable diseases. Non-communicable diseases which you gather in your own body by your habits, eating habits, living habit, stress, laziness. These things are diabetes, coronary artery disease, and liver diseases, then your kidney diseases. These are not communicable. They are inside your body. You have gathered it from your own bad habits. And communicable disease is this, one person to another is communicable diseases. Spread is communicable. And accidents, you should also include the accidents, incidental and accidental deaths. They are also considered under disease specific death rates. Okay? Proportion mortality rate, burden of the disease in community, that is which disease has more prevalence in society in compared to another. See, coronary artery disease, repeatedly telling CAD, diabetes, malnutrition, they are causing significant amount of burden on healthcare facilities, and proportional mortality is also high. Case fatality rates. See, I have changed 1 or 2 part of this slide from the previous parts. Case fatality is risk of person dying from a certain disease in a given period of time. It is measured a number of deaths divided by number of cases of that specific diseases during that period. This is very easy. Case fatality rates. Case fatality means death rates. Fatal. So it's case specific. measures the pathogenicity, severity of virulence, but can be used. I have previously I mentioned it can't be used, but it can be used. It's a mistake. Can be used in poisoning chemical exposure, short-term non-disease causes like deaths and accidents also. Okay. Everything you have to mention, at least you have to write the definition. If you can add one or two lines, that's very good. At least you have to write this, the definition, proportional mortality rate, disease specific death rates, this thing at least one or two lines. See, these things are formulas, you know it's given in book, but they're not relevant to this thing. I've shown you how to, see I asked you to calculate that a natural increase in growth rate. Crude birth rate was 12, crude death rate was 8, divided by 10, that is 1.2%. Rate is always mentioned in percent, okay? That question I gave you, na? In first slide, okay? See, years of potential life lost, okay, due to premature deaths, it occurs before the age of a dying person. See, if a person on an average, he or she may live up to 70 years, but if he died at 40 years, then 30 years of his life is lost. This is called years of potential life loss. Potentially, he may live up to he may live for more than extra 40 years, but he died at 30 years, so the life lost is 40 years. Mortality indicators are traditional measures of health status, most often used for indirect indicators of health. As infectious disease has go down, they lose their significance in developed countries, but is still prevalent in developing countries. Okay? Fertility indicators, you know, age of the marriage, it depends on this type of things. Age of the marriage, then and then duration of marriage, 10 to 25% more duration of first 5 years. Okay? Highest birth rate 5 to 10 years, lowest after 25 years of marriage. These things are all dependent. Fertility in India, fertility means childbearing part. How much a woman can bear depends upon this factor. Age of marriage, lower age of marriage means higher years of getting pregnant, higher years of fertile period, more babies. Duration of marriage, 10 to 25% of the births occur in first 5 years, highest in 5 to 10 years of marriage. They have to mention, na, spacing of children is very important. Gap between births help the mother to recover. At least 2 years of gap is very important. Okay? See, literacy is very important. Lower literacy women are getting pregnant more. Higher literacy women are educated. They are very aware. They will take good spacing and family planning methods, and they will get less pregnant, and birth rate will remain higher. The society having good literacy, good education, the population we see in developed countries, na, population is less. See, this thing I will explain. Everything is in your book. You have to write it. This thing at least 1 or 2 lines from this part. Okay, this thing is Muslim, Hindu, the caste pass. These are extra. At least you have to mention education, higher economic status, caste and religion, family planning, better family planning, declines fertility. This program can be initiated rapidly with limited resources. Okay. Other factors I know: physical, biological, socio-economic, place of the women in society, value of the children. You know, I have explained in there in your book also. Thank you.